It's an important step forward that has been made. The Israeli Health Ministry says that it has launched its first ever suicide prevention campaign targeting men. 78% of all people who die by suicide in Israel each year are men. That's according to the ministry's data. And it aligns with the statistics that the World Health Organization also reports. Well, as the Israel-Hamas war continues to rage, this campaign is perhaps more essential than ever. And joining us now, Ziv Cohen. He's a forensic psychiatrist at the Cornell University Medical Center. So first of all, give us a sense of the numbers in terms of the people who commit suicide in Israel every year and how that has changed since the start of the war.
So interestingly, we did see some data that suicide rates have not increased in Israel since October 7th. The number of suicides in Israel is about 500 a year, and as far as we can tell, it's been obviously less than a year since October 7th, but that number has not increased. But I think that the Ministry of Health is pointing out that there has not been a systematic effort towards suicide prevention by the Ministry of Health in Israel and by the government authorities, and they're really trying to catch up with what has been shown to be the best practice in other first world countries in terms of having a national suicide prevention plan.
Tell us.
And the issue with men, of course, is that men have higher suicide completion rates than women. So women attempt suicide more frequently than men, but when men attempt suicide, they're much more likely to succeed. And one of the reasons is that they tend to use firearms, whereas women tend not to use firearms. And if you use a firearm, you're more likely to succeed. So the fact that Israel has most completed suicides in Israel are men rather than women. And that's true also in the United States.
Tell us how many men are at risk in Israel today and how the war specifically has impacted those numbers.
Well, I think that whenever there's stress on society, we do worry that we're going to see an increase in suicide rates. For example, in the United States, when we saw the Great Recession, we had a dramatic increase in suicide rates, particularly in middle-aged males. So again, we are looking to see whether there's going to be a bump in rates in Israel. Fortunately, we haven't seen it yet, but I think that in terms of the stress on men, of course, we're thinking about the reservists, we're thinking about the conscript soldiers, people who are removed from their homes, from their safety nets, from their support networks, and going out to the front and fighting for extended periods. That's putting people under a lot of stress. We do know that combat trauma is associated with higher suicide rates. And what we often have seen, for example, in the United States, is that there's a delayed effect. So when the U.S. launched the second Iraq War, there'd be a delayed effect of a year or two before you start to see the spike in suicide rates amongst soldiers and veterans. So I think that the concern is that, what are going to be the ripple effects of this prolonged period of war footing that Israel is in, and that also there's no end in sight to it. So I think that this campaign is really needed right now to hopefully prevent a ripple effect from this prolonged war.
All right. Well, I'd like to thank you so much for joining us. Very important topic. Obviously, there needs to be more of an effort to encourage men to talk about their distress, not only in the state of Israel, but around the world. So obviously, this campaign is coming at a very, very essential time. Ziv Cohen, I'd like to, again, thank you for joining us and talking about this pressing issue.
Good to be here.